So we are back with a new set of questions. So let's begin. So the first question is identify A, B, C, D from the image based question below. So what you see is you have electron transport chain, and we have asked all the 4 A, B, C, D points which are inhibitors of the complex in the series as 1, 2, 3, 4. Okay. So this is a factual based question. So let's see. So so the complex A, the first complex is inhibited by few compounds which the mnemonic is PAR. One is pyridine, amobarbital, amobarbital, okay, and rotenone. Okay, next the complex 2 is inhibited by succinate. You have a competitive inhibitor called as malonate. Okay, and complex 3 is inhibited by BAL and antimycin C. Complex 4 is inhibited by few characteristic compounds like cyanide, carbon monoxide, and H2S. Okay, so the answer is A. So yes, amobarbital for complex 1, malonate for complex 2, BAL for complex 3, and cyanide for complex 4. Okay, next question. So which of the following drugs cause the following adverse drug reaction? So this is an image based question. So you see that there is a dermatological ADR, and this ADR is known as flagellate dermatitis. So flagellate dermatitis, and this is a known ADR of bleomycin. So next other points are cepacitabine is known for side effect of hand and foot syndrome. Okay, then doxorubicin for radiation recall syndrome. Okay, paclitaxel for peripheral neuropathy. Right. So next, which of the following paraneoplastic dermatosis is associated with the internal malignancy? Okay, so here we have a paraneoplastic dermatosis. Okay, so what you see is multiple seborrheic keratosis in the back. Okay, so this is also known as sign of lesser Trelat. Okay, and this is suggestive of gastric adenocarcinoma. Okay, so the answer is gastric adenocarcinoma, right? The other options, pancreatic carcinoma gives a paraneoplastic keratosis dermatosis of migratory thrombophlebitis, also known as Trousseau sign. Okay, and lung carcinoma gives tripalms. Okay, and grade 4 clubbing. Okay, other is Hodgkin's is known for the paraneoplastic dermatosis of acquired ichthyosis. Okay, so next, the marked curve in tympanometry is seen in which of the following? So we have different curves, and one marked curved is this one. Okay, so we'll learn it. Okay, so the first curve, type A, is a normal curve. So in tympanometry we see how the tympanic membrane, the pressure in respect to the tympanic membrane. So this is the normal thing. Okay, D stands for discontinuity. Okay, so if there is ossicular discontinuity, so this is the curve where the compliance is increased. Okay, so opposite of that is AS. So AS stands for the tympanometry in otosclerosis, and here the compliance is decreased. Now you see that type B is the graph when you have no barrier, like no tympanic membrane. So in cases of CSOM, or perforation, this graph is seen, whereas C is there is a negative pressure. So this is a negative pressure in case of your eustachian tube obstruction. Okay, so the correct answer is otosclerosis. Okay, so next, which of the following drugs has adverse drug reaction as shown? So what you see here in the cornea are opacities, and this is also known as corneal verticillata. Okay, and the known drugs to cause this side effect are chloroquine, indomethacin, amiodarone. Okay, whereas timolol, which is a beta blocker, topical beta blocker, does not cause this side effect. Next question. The following X-ray is suggestive of which of the following congenital heart disease? So what you see here on the chest X-ray is you see a typical figure of 8 appearance, or snowman appearance, which is characteristically seen in TAPVC, which is total anomalous pulmonary venous connection in supracardiac type. Okay, and coarctation of aorta, what we have is sign of 3 and inferior notching of ribs, which is Rosler's sign. Top we see boot shaped heart with oligemia. Okay, next question. Below shown abnormality of placenta is, so what you see here, actually this is more of a cord abnormality, where the amniotic membrane and the membranes have an attachment of the cord. Okay, so this is also known as filamentous insertion of placenta, filamentous insertion of the cord, sorry, and this predisposes to vasa previa. Okay, next. So the placenta circumcuriata is when that it is divided into different lobes, and circumvallate placenta is when the amnion and the chorion they overlap over the part, and circummarginate is the attachment in the amnion and chorion in the periphery. Which among the following is the egg of trichura, which is whipworm? So we have 4 eggs. Okay, so this is, yep, A, B, C, D. So let's see. So this is a typical D-shaped egg, what you see, and this is seen in Enterobius vermicularis. This egg, what you see here is there are bumps here, also known as mammillated appearance. Okay, this is seen in Ascaris. Okay, here what you see is on both the poles there are mucus plugs. Sorry, so we have polar plugs on both sides. This is characteristically seen in whipworm, whereas a thin shell or a blastocyst appearance is seen in hookworm. Okay, so A is hookworm, B is whipworm, C is Ascaris, and D is Enterobius. Okay, next question. Which of the following structures pass through the diaphragmatic opening at T8 level? Okay, so this is a very important topic. We have diaphragmatic openings at T8 level, at T10 level, and at T12 level. So there is a short mnemonic which says I 8 10 eggs at 12. Okay, so we'll see how much this will help us. So I8 stands for IVC. So to the T8 level IVC passes. The other part which passes is the right phrenic vein. Okay, sorry, right phrenic nerve, sorry. And here at the T10 opening we have the esophagus, the right, the left vagus nerve. Okay, and here at T12 level we have aorta, thoracic duct, and azygous vein and hemiazygous vein. So yeah, right phrenic artery, right phrenic nerve T8 level. Left phrenic nerve, sorry, this should be left vagus T10 level, esophagus T10 level, hemiesophagus T12 level. Okay, so last question. Okay, this is not, so this is the, okay, so the following condition, what is the toxin here? Okay, toxins in it. So you have neural atherism which has one, so it has latent, then one no stick, then one stick stage, two stick stage, and crawler stage. So this is the neurological progression of the disease. Okay, it's neurological progression of the disease, and neural atherism is due to the contamination of your Lathyrus sativus in Kesari dal. Okay, in MP, UP, they use a lot of this, and if you use more than 30% of the consumption, you are prone to neural atherism. So and the toxin is BOAA, which is beta oxalyl amino alanin. Okay, the other toxins are responsible for pyrazolidine for endemic ascites, sanguinarin for epidemic dropsy, and aflatoxin for your aspergillus, caused by aspergillus flavus, which is also a carcinogen predisposing to HCC. Okay, thank you, and next time we'll have a good session of 10 questions of numericals which are asked in different subjects. Okay.